start the webinar with some quote. So this is Elon Musk, and this is the quote I liked. When something is important enough, you do it even if the odds are not in your favor. Now, what do I mean this thing for all homeopaths? I had my education in a rural homeopathy college. And when I got the idea to become a homeopath, it was very difficult. Like my colleagues, my friends, my relatives used to tell, अरे होम्योपैथी करेगा तो फिर खाने को क्या मिलेगा, कैसा चलेगा घर. So I had the idea that अगर मैं होम्योपैथी करूंगा तो मुझे ऐसी जगह पे करना है जिसको होम्योपैथी का थोड़ा मालूमात नहीं है. Those people who are not aware about homeopathy, I wanted to practice in that area. And I am very happy to share with you that all my morning OPD is from village people, and those people are very happy, and they come by very obliged way to get healed. So let's start with the case. This is one of the case of diabetic gangrene, and this is the photo. You can see the wound, the blackness, and the discharge. The bad discharge was there. Offensive smell was there, and patient had lot of pain, burning type of pain. Patient's relative called me that, sir, there is a case of gangrene. Can you come? Can you see? I told, let me see first whether I will be able to do anything for you. And I went to a small hut that the patient was sitting. She was having lot of vomiting, chills, fever, and terrible pain, burning pain. So I advised her for some investigations like KFT and all. And my dear friends, it is very difficult to take a judgment in these cases because there is a lot of risk to keep the patient at home or to keep the patient at hospital. We need to prevent the patient from landing into septic shock. We need to prevent the bone necrosis. We need to prevent the gangrene. At the same time, we need to reduce the fever, chills, and the pain which the patient cannot at all bear. And if you take this type of patient to any allied practitioner, it is a hard responsibility for them also, because the surgeon needs, he'll do surgery. So you need to determine the vitality of the patient, and you need to be a good clinician first, and then it will help everywhere in every case. So I'll show you the follow-up after 3 days. The vomiting stopped, chill stopped, fever reduced, burning pain was reduced. So this is the photo after 3 days. You can see the change. This is after 3 days. After 5 days follow-up, the burning pain was reduced, discharge also reduced, and I saw some signs of healing. You can see the red granulomatous tissue appearing here. Still the black dead part is there. This is the photo. Now the patient could walk in my clinic after 5 days. Now I'll show you the follow-up after 20 days. After 20 days, all the dead part got detached. The discharge reduced completely. And I saw some good granulomatous tissue appearing there and some signs of healing. At this point of time, the fever was not there, no chills, no vomiting. The pain, slight pain was there. You can see here all the dead part got removed. And I'll tell you, whenever all the dead part goes away, the pain of the patient, it literally comes to a stopping way. It literally stops. You can see all the red granulomatous tissue appearing and healing is started. So this is the part, and I'll show you the last follow-up. So my dear friend, this is the follow-up where all the part is been healed and the patient can walk and do her profession. This is after 6 months of tremendous efforts by patient and me. There was daily dressing by patient as guided by me, and we had prevented her from landing into septic shock and all the things, and we had prevented her limb. So this is the video testimonial of patient. अभी दर्द है क्या?
अभी दर्द नहीं है, रात में थोड़ा दर्द होती है शाम में।
अच्छा, और मतली उल्टी? पहले क्या होता था?
पहले मतली उल्टी हो जाती थी शाम को।
और
खाना खाए थे।
और
पैर में हाथ पाँव दुखते।
और पैर में क्या होता था?
पैर में मुंगिया है, आज भी मुंगिया है।
पहले क्या होता था पैर में?
पहले भी मुंगिया से हो।
दर्द
ही नहीं होता था ज़्यादा, इसमें
ये इधर पैर में दर्द नहीं होता था?
ये पैर में होता था ना।
हाँ, तो वही तो मैं पूछ रहा।
ये पाँव में होता था।
कितना दर्द होता था?
बहुत होता था, कम होगा।
अब कम हो गया क्या? कितना कम हुआ?
8 कम हुआ।
कितना दिन में?
अभी आपको इलाज करेगा।
कितने दिन हो गए?
कितने दिन हो गए?
4 दिन में फर्क गिर गया।
ऐसा क्या? अच्छा. So this is the testimonial, my dear friends. Now let's come to the analysis part. I tell you that I am a person who needs to stick on basics, and to need our prescription, it needs to be justified. Anyone seeing the prescription should tell you that yes, this is fine, this remedy can be given. मुझे लग रहा है, मुझे ऐसा है, ऐसा है. Let's come back to the analysis. So I take generalized rubrics first so that I could arrive to a group of remedies. So these generalized rubrics are taken: gangrene, gangrene lower limbs, gangrene feet, wounds, wound burning, smarting, and proud flesh, wound healed, slow, wound septic, suppurating. And the only symptom which I had is warmth amelioration. So my dear friends, you could see in the repertory there were remedies like arsenic, then lecasis, then anthracinum, pyrogenum, sickle core, and all the vipera. And we had prescribed her the remedy arsenic album on the basis of the most peculiar pain, burning, which all people know. But this is what, my dear friends, all the polycrates are very helpful. We should learn first the ordinary things to become extraordinary. So all the polycrest remedies can give you superb results in any type of case.
21 hours.
But just you need to be perfect in the prescription, and you need to know why is this remedy given. So we had given her this remedy due to the burning thing and the warmth amelioration. So I usually give the in this type of cases water doses. I gave on the first day every hourly 2 spoon. You can learn about the water doses from Dr. Sujit Chatterjee or Robin Murphy. And the comparative remedies are lecasis, bothrops, sickle core. In sickle core, you could find that there is cold amelioration. In bothrops, the pathology is due to some another reason. In lecasis, you would see in the wound black border appearing. So we'll arrive to the next case. Convulsion in 1 day baby. I got a phone call from one of my doctor friend that his wife delivered a very good baby boy, and he was very happy. But unfortunately, he had some disease, and the boy landed to NICU. His wife was in another hospital, child was in other hospital, father was out of both hospitals, and baby was having continued convulsions. It is called a status epilepticus, having repeated convulsions. And in spite of giving all the allopathic medicines, the convulsions were not stopping. So he called me that whether I can do anything. I told, let me see first, and then if I get some good thing, I prescribe. So I went to the hospital and visited the NICU. So it was a very difficult thing, as this was my first case of 24-hour baby, 1 day baby, newborn. And I went there, and a thought came in my mind that how will I take the case and what will happen? I need to give some good result. I need to help this baby. So I just was there for 15 minutes observing the baby. And later on, I thought I should ask the nearby nurse. And I told that, please let me know what is the thing, what are the symptoms he's having. So they were very much astonished that what is this man asking for. So one of the nurse told me very interesting thing about the baby. She told that the baby was having hiccup during her convulsions, during the convulsions, and I thought I got a gold mine in this case. So kuch to mila hai bhai, kuch nahi se. And later I observed the nurse also told me that, sir, I see many babies, but this baby is sleeping in this way, and I don't know why. So I also saw this thing, and I came and I just started the analysis. So this is the follow-up video of his father. I'll show you.
दिनांक 30/10/2017 मला मुलगा झाला. मुलगा झाल्याच्या नंतर
Is this audible?
2 ते 3 तासांनी
Can anyone
त्याला
reply?
सीझर आले, म्हणजेच कन्व्हर्जन झटके. ते झटके आल्यानंतर त्याला NICU मध्ये ऍडमिट केलं. ऍडमिट केल्याच्या नंतर त्यांची ट्रीटमेंट सुरू झाल्याच्या नंतर सुद्धा 2 दिवस कंटिन्यू त्याला झटके चालू होते. आमचे तज्ञ मित्र डॉक्टर राज बोंद्रे, होमिओपॅथिक तज्ञ, यांच्याशी संपर्क साधला असता त्यांनी ट्रीटमेंट चालू असलेल्या हॉस्पिटलला येऊन व्हिजिट दिली. व्हिजिट दिल्याच्या नंतर माझ्या मुलाची केस टेकिंग केली. केस टेकिंग केल्याच्या नंतर रेपर्टरायझेशन केल्याच्या नंतर त्यांनी माझ्या मुलासाठी औषध दिलं. औषध दिल्याच्या नंतर 3 तासाने पूर्णपणे त्याचे झटके बंद झालेले आहेत. थँक्स डॉक्टर राज.
आणि आता किती दिवस झाले झटके नाहीयेत?
तुम्ही औषध दिल्यापासून एकदाच आला होता. औषध आपण 3 दिवस कंटिन्यू केलं. त्याच्यानंतर आज जवळपास 7 दिवस झाले झटके बंद आहे. माझं बाळ पूर्णपणे कॉन्शियस आहे, अलर्ट आहे, बॉडीची मुवमेंट व्यवस्थित आहे. न्यूरोलॉजिकल डिफिसिट वाटत होतो, तोही पूर्णपणे बरा वाटतो. ट्राय पण केलंय, फीडिंग पण चालू आहे.
औषध कसं देत होते तुम्ही?
सुरुवातीला 10 मिली मध्ये 4 ड्रॉप औषध देऊन त्याच्यातलं 1 मिली 2 टाइम सकाळ संध्याकाळ दिलं. त्याच्यानंतर एक झटका पुन्हा आल्याच्या नंतर 3 वेळेस केलं आणि नंतर टॅपर करून 3 दिवसात औषध बंद केलं.
आता त्याचे सगळे एपिलेप्सीचे औषध बंद आहेत का?
पूर्णपणे बंद आहे.
कोणते कोणते?
ॲलोपॅथिक लेव्हिप्रिल म्हणून असते, त्याच्यानंतर एक टोपामॅक म्हणून असतं एपिलेप्टिक, त्याच्यानंतर सेडेशनचं मिडास आणि रिव्होट्रिल टॅबलेट म्हणून असते, ते पूर्णपणे औषध बंद.
आणि होमिओपॅथीची पण बंद आहेत?
होमिओपॅथीची सुद्धा बंद आहे.
थँक्यू. So this was the follow-up of the father. Now let's analyze the case. As I told, I first take a group of rubrics or symptoms which are very generalized to the case. So generalities, convulsion, spasm, children in was the rubric. Next, children in newborn in convulsion, spasm, and the master rubric, which was a gold mine, hiccup convulsion during, and the observation clenching fingers convulsion during, and clenching convulsion during epileptic. So the group of remedies which we come to is cuprum, cicuta, hyoscyamus, and there are various very superb remedy in homeopathy like Oenantha crocata, Artemisia vulgaris, and Bufo. So my dear friends, I will tell you one key to convulsion cases. What is the key? You need to go for the case, like you need to take what are the symptoms before convulsions, what are the symptoms during convulsion, what are the symptoms after convulsion. You need to ask this to the patient, whatever he remembers. You need to ask this to the relatives, whatever they remember, and ask to multiple relatives. One of them will, in one of the sector, you will get one of the clue. Some child or some people before convulsion, they may get the aura, or the convulsion may start after something. So in some patients, the eyes may roll upwards. In some patients, they may get diarrhea during convulsion. So these are the clues for you to guide towards specific remedy. And whenever you prescribe for a pathological condition, you need some very concrete, very base, perfect analysis and perfect symptoms which should exactly match to the patient. So we had given him cuprum on this thing. If you will read cuprum for Phatak repertory, you will find the exact phenomenon, clenching of thumbs in palms. In cuprum, you will see that this is the phenomenon. The thumb is in between the fist and there is convulsion. And the exact phenomenon, hiccup before vomiting or convulsion in Phatak. So we had prescribed him cupramet on this thing, 30 in water doses, 1 teaspoon every hour, and it helped the patient a lot. So next case is of dry gangrene. This was a patient having thrombus in the femoral artery, and he was a chronic smoker, age 50, and was urgently advised for below hip amputation as he had severe pain. So what symptoms did we have? Now I practice in an area where I don't get many symptoms. There are 50% cases which are dry. I don't get fear, dreams, delusions, and other mind rubrics. So in those cases, there is a different approach. So I'll tell according to repertory, I have arranged the cases. You can see how a repertory is used in which type of case. So in this case, the patient, so this is the patient's photo. Already the toe has been amputated and now he is advised for below hip amputation. You can see the bone is getting gangrenous now. So this is the video testimonial of the patient. Let's see. This is after the treatment.
कसं झोपावं लागायचं पहिले बर काय व्हायचं असं झोपल्यावर बरं लागत आणि आता असं झोपतच नव्हतं आता झोपता येतं का असं आता असं पाय इतकं असं लागून झोपतो इतकं अच्छा सर असं झोपता येतं आता.
So patient in his complaint told that he could not sleep by folding his limb, and in this video he is telling that he can sleep now by extending his limb, right, which was impossible for him. And this is the audio testimonial. I had called him after 3 years. Let's see what he says.
हॅलो, हा खडेकर जीचा फोन नंबर आहे का?
हा खडेकर.
म्हणलं डॉक्टर बोंद्रे बोलतो जालन्यावरून.
हा बोला, काय चाललंय?
कशी तब्येत आहे?
तब्येत बरी आहे.
पेशंटची तब्येत कशी आमच्या?
तुमच्या पेशंटची पण चांगली आहे, पण ते काल पुण्याला गेले डोळ्याचं ऑपरेशन करण्यासाठी.
नाही, पायाचा त्रास कसा आहे त्यांच्या?
पायाचं बरं आहे, ठीक आहे. आता
पायाचं पुढं काही ऑपरेशन नाही करावं लागलं ना?
नाही येऊ एखाद दिवशी भेटायला तुम्हाला.
नाही, पण पायाला बरं लागलं ना?
हो, एकदम जखम निर्मळ झाली. आता
दुखत नाही ना?
नाही दुखत नाही, काय नाही. गोळ्या कमी पडल्यावर मग थोडी आग होती पायात.
चालते बोलतेत ना?
हा, ते जर गोळ्या त्यानं 4-8 दिवस बंद केल्या तर मग आग होती.
चालतेत फिरतेत का?
हो
चालतं. ओके बरे.
चांगली 1 किलोमीटर पायी चालते ना.
बरे.
So this was the follow-up. So let's analyze the case. We had taken, what was the pathology of the case? There was thrombosis, right? And what was the affection? Lower limb. Where is the affection now? In toes first. And how is the part seen? It's bluish. It is threatened gangrene. That gangrene would form. Some parts are gangrenous, and gangrene would form. And wound is healed, slow in healing, and there is thrombosis. So we had taken this rubric in a generalized way so that we could come to a group of remedies, and then we would read the materia medica by concluding to a 3 or 4 group of remedies. So the first remedy here we see is arsenic, lachesis, bothropes. Then the other remedies related to asafoetida and other thing. Any suggestion, Alex? Any suggestion? Right. So we had prescribed him remedy known as bothropes, and it gave phenomenal result. Now, why I have selected this remedy? Let me show. If you'll read bothropes from Phatak repertory, it tells me the venom of this snake is most coagulating. Therefore, it is expected to be useful in thrombosis and thrombotic affections. Yes, Mustafa, Bothropes, Tejaswini, Bothropes. Yes, my God, Bothropes. All people are perfect. So, and the second thing which I got in the Phatak was very interesting for me. It is bone becomes bare from gangrene and becomes necrotic. I was very astonished. My dear friends, I'll tell you, you will learn more in your clinic. It is just a base where you practice, means wherever you have educated or wherever you have taken education. Patient is the greatest teacher. So I have learned all this thing in my clinic. Just you need to have that passion, that eager to find the best thing for that patient. You need to be the best doctor for that patient. You need to justify the case. You need to be perfect in your remedy. So we have given both ropes, and in water potency, I had given 2 teaspoons every hour, and this saved the whole limb of the patient, and he is walking, talking. So now let's see some simple cases, which like dry cases, there is nothing available in those cases. How to analyze these cases, how to proceed further. Let's take a case of alopecia. So this is alopecia. Now just observe this case, as I told you already, there is nothing in this case which I got. Just observe this case and tell me what is your observation by which we can prescribe. Just by this observation. Any suggestions of this observation, not the remedy? You need to, means what we will find in materia or repertory from this thing. So what I found out that, so this is the second photo or second follow-up. This is the third. Small hairs you see started appearing. You can see here the hair started, and this is the follow-up after 6 months. She was very well. She was very happy. So in this type of cases, I use the repertories like Knerr, Phatak, where Knerr is a repertory for lay people in a layman language. So you should understand how is the repertory created, like Phatak, how it was created, what was the base, Knerr repertory, what was the base. So I observed that the alopecia was very large. I didn't see any alopecia spots such a large. So I just searched in the reference work, bald spot large, and to my goodness, I got a very super remedy and a super rubric, hair baldness spots large, and only single remedy was given in Knerr. And I consider Knerr's repertory very authentic and his work very authentic, so that we could rely on a single rubric also to prescribe. So I had given given her Hiparsulf for 5 days and repeated every month. After 6 months, this is the result. Next case is of psoriasis. Let's see. Thanks, Alex. Yes. So next case is of psoriasis. Female have itching, and here we will get some mental symptoms in this case, or a complete case. So the patient had a lot of anger, and she could get angry very easily. She had itching, and she told me that whenever I get angry, my itching increases, my patches increase. No specific thing in dreams, no specific thing in fears, and all other things, no PQRS symptom. So this is the case. My cases are little bit short because I'm not very much capable, or I have not done much webinar or teaching, so I'm busy in practice. So this thing is, this was the patches. These are the patches, psoriatic patches. This is before. This is before. This is before treatment. This is before treatment. And this is after treatment, my dear friends. You can see the result. No steroid, no ointment, no cream. So this is the result. Other thing is this patch. You can see here. So this is the result. So you can also give this type of results. It's very easy. you just need to be unprejudiced. You need to be with the patient, not yourself. Shankaran sir used to say that you need to see the whole elephant of the case. Means you need to go to every sector and just ask, tell more, tell more. You should be very inquisitive and very peaceful and silent. You should just wait and let the patient speak. You should be like a CID officer who is just observing everything, every minute details. How is he sitting? How is his body language? How are his eyes? How is his feeling? Does he want to tell? Is he awkward about the situation? So in this way, you need to be very specific. So let's analyze the case. So we had taken the rubrics like eruption, psoriasis, admonition, aggravation, anger easily, anger trifles about. And I have taken this rubric, a very interesting rubric I got. You can see here the patient told us, whenever I get angry, I observed my itching and patches increase. There are two things, itching and patches, right? So we need to have these both things. We need to analyze. We need to first take this thing and then see what are the remedies which show us that whenever one has anger or an emotional situation, his itching increases or the patches also increase. So there is an interesting rubric which I got is excitement, emotion, aggravation. And I utilize this rubric everywhere. Whenever I get some physical, mental relations, it is a very important situation or very, very important thing for us. And I utilize it very well. Like for example, if a patient comes and he tells me, sir, मुझे क्या होता है ना, किसी का मैंने ऐसे सुन लिया तो मुझे एकदम धड़ धड़ होने लगता. So what is the rubric? Palpitation, excitement, emotion, aggravation. Next, a patient comes, सर वो मैंने सुना कि हमारे बाजू में कोरोना हुआ था और वो गुजर गए, और वो जैसे मैं सुना तो मेरे हाथ ऐसे एकदम वीक हो गए, पैर ऐसे वीकनेस हो गया. What is the rubric? Weakness, excitement, emotion, aggravation. So in this way, this rubric helps me a lot. You should find it anywhere and you should ask, like, whenever a person gets an emotion like anger or happiness, what are the changes that occur in his body during that time? And that is very much helpful for us to prescribe. So on this basis, we prescribed her Staphylococcus aureus, and Staphylococcus aureus helped her in all the suffering. So next is a case from Knerr Repertory. This is a case, a simple dry case, as I said. There are no symptoms in this case also. A patient came to me at this time 7:30 p.m. and he told me, sir, ये ऐसा है, आप कुछ करो, बहुत खुजली हो रहा है. So here you can see all the eruptions all over his body, lot of eruptions. So, and only this thing was available. I was literally sitting for 15 minutes asking, tell me more, और बताओ, ये सपने बताओ, डर बताओ, खाना बताओ. So I didn't get anything, and I just had two things. I was able to see that it was lichen planus, and second, there was lot of itching. So this is the follow-up. You can see there are no patches, no steroids, no cream. You can see all the eruptions gone. You can see the follow-up. This is the follow-up. All the eruptions gone. So this was analyzed by using Knerr Repertory. I just wanted to find out a remedy or a simillimum where patient had lichen planus and he told me, sir, there is lot of itching. I didn't knew this remedy was for this thing before that. I'll tell you the truth. I told you the patient make us learn. So I just searched for lichen planus itching, and there are remedies. But I thought it is violent. I wanted to find a word for violent, great, something like that. And I came across this thing, eruption lichen itching with great, and who has given this Knerr? So I can rely. And my dear friends, you can see this was given is phytolacca. Before that, I knew this remedy phytolacca only for fat patients, as you already know. So this was the case about phytolacca, and phytolacca 1 m I prescribed, and this helped the patient. Next is a case of analyzed using Phatak's repertory. A female aged 40-45 came to me for psoriasis and had lot of itching, scales, too many patches on upper limb, lower limb, back, and there was no specific thing. Let's see what were the specific. There were itching aggravated by fruits, apples, and itching was aggravated at night. No specific dream, no specific fear. Very dry case, as I said. So let's see the patient. So these are the psoriasis patches. You can see. You can see after the remedy, all the patches are gone. So constitutional medicine helps in this phenomenal way. All the things get healed in a perfect way. According to Hering's law, it is a perfect simillimum will take you to another level. You can see. No cream, no steroid, nothing. Only our simillimum remedy. So let's do the analysis. First, we would take a general picture. Now, I had learnt in this TOS that you should utilize right and left brain both. One of my friend Modak was there, and I didn't used to get any remedy, but he used to tell, "अरे सेपिया, अरे नेट्रोमोर," in this way. मैं बोला, अरे भाई मैं तो ये सब लिख रहा हूँ, ये क्या है, मेंटल्स ये है, फिजिकल ये है, sectoral totality, this totality, that totality, and he used to work by his heart. So sometimes you need to see the picture from far away, see the mountain from far away, and then probe in and see. So zoom in and zoom out. You should see at both the times what is the thing, what is the thing. So in this case, we saw we had two things like aggravation at night, and very interesting thing which I learned from this remedy is apple aggravation. Patient told me, sir, मला सफरचंद खाल्ले तर जास्त त्रास वाढतो. So I was very keen to find out the remedy. What is this apple means? Apple aggravation. And my dear friends, here the Phatak repertory will help you. Dr. Phatak was an Indian doctor, and all the other repertories are Western repertories. So in Phatak, you would get some very peculiar things about the Indian thing like sugarcane, guava aggravation. What is the remedy or guava? So this is the thing. Let's see how this patient was helped. So we prescribed her arsenic iode, and if you see Phatak here, you'll see worse by apples in a very small letter. So we could come here due to repertory, my dear friends. We cannot remember the whole materia medica. So you need to be a very fine person so that you can perfectly analyze the case through repertory. And so, my dear friends, you should study repertory. And so our side was prescribed. Let's see other case. Now, here also you need to just observe and listen what is happening to this patient. So this is the case. Did you see what is happening to this man? Can anyone tell? Just 5-10 seconds, I'll play it again. So this is the case, and you need to analyze this case in this way, because I didn't have any type of other symptom here. And this is the follow-up. You can see.
अभी कैसा है? एसिडिटी में कुछ फर्क लग रहा है क्या? डकार डकार अच्छा, डकार में कितना फर्क है? अच्छा, कितने दिन हो गए? शुरू हो गया. अच्छा.
So within some 5-15 days, he was able to get relief in his symptoms. So how to analyze this case? Now, my dear friend, this was an eructation, and I also learned in first time that eructation can be so long, and you can see the eructations are loud belching, the rubrics which we took, eructations empty profuse. And what was the interesting phenomenon is eructations, loud belching, involuntary. He could not stop them. He was willing to stop, but he could not stop them. So this was a very interesting rubric I learned. I learned asafoetida in this way. So this is what a pure observation can help us. You need to be pure observer. As Shankaran sir says, just sit calm and just observe. You need to be very calm in order to observe many things, and it will help you. So my dear friends, asafoetida helped him. So this is the literature, and you should always staunch on the literature. You should see whether it is given in any type of book, in Phatak, in Clark, in Murphy, or in Sear's book, anywhere. Here you can see in the digestive tract, it produces flatulence and spasmodic contraction of stomach and esophagus with reverse peristalsis. Everything comes up, nothing goes down. Explosive eructations. Flatus passing upwards, none downwards. So on this basis, asafoetida was given. And I have lot of cases. This is renal failure case, where we helped the patient in acute renal failure. Creatinine was 10 and was 7.5, and it came down to 2.1. This was the case. Thyroid cases, where there is thyroid increase to a certain level, and we helped her. Thyroid cases. Skin cases. So this case I will tell you, I didn't had anything in this case. Just the patient told me की सर मला काय होतं ना की जेव्हा पण मी जेवण करते तर माझ्या डोळ्यातून पाणी येतं, and there was eczema. So you'll email me or message me the remedy. What was the symptom here in this case? Sir, when I eat food, there is lacrimation. Okay, and there are two remedies. And she told me hot lacrimation. There are two remedies in homeopathy. You'll email me the remedies. Okay. So this was the case, and on that basis, prescription was given and everything was fine. This is the case. There are many cases. So my dear friends, in this way you can learn more repertory and be more specific, be more perfect in your prescription. Just be honest with your patient and just be honest with yourself. Don't go behind money. Just try to learn every day in every case. Just sit down and just you take the symptoms and analyze those and come to a point of time, a part of time where you could prescribe the remedy. Justify your prescription. Your prescription should be based on the pathology. It should be based on a perfect thing where everyone, if anyone sees, he could tell, sir, it is right, the remedy is right, and it can help him. Your prescription it should not lie in easy way. So there are many cases, and I'll conclude the session. How every person is trying to use repertory and trying to coming to a remedy. Yeah, Meenakshi Ratanpal, Oleum animal. Yes, there is another remedy for that thing. You are on a right track. Last, I'll tell you, dream it, go for it, and achieve it. My dear friends, unless and until you'll have a vision, you'll not be able to achieve, and you'll not be able to go there. Just be there. Just be in that specific time. And this is the time when you need to invest. The first starting 5 years of you are the years which will take you to a very sharp limit. And I have seen more than 6,000 cases in 5 years. So this, and my friend, he has done tremendous. So you can also do this thing. Just you need to be yourself and be kind, be humble, be honest with your profession, be honest with your patient, and you'll achieve it.